if they're actually really worried about people and they want them in treatment and they don't understand that forcing them is not the right way to do it.
Drug policy experts and people who use drugs say they're concerned that the BC NDP and the BC Conservatives are both open to forced treatment. The BC Conservatives made a promise this week to force people with substance use disorders into treatment if elected, and the BC NDP leader, David Eby, 2 years ago when he was on the campaign trail for the premiership, suggested that involuntary care was necessary for severe overdose cases. When asked about this at a press conference Thursday, Eby wouldn't confirm what his stance is, but said there's a group of patients with untreated mental health issues who are addicted to opioids and have brain injuries from repeated overdoses.
So we brought in Dr. Daniel Vigo, an expert in this area. He does assertive care in the province. He's been working with us to identify a better path to support this unique group of patients that really needs our support to stay alive. And we'll have more to say about that this week. And I think Sunday is the planned date for that.
The BC Conservative Party has said its involuntary treatment program would support people who, quote, pose a risk to themselves and others. At the moment, people can be taken into care under the Mental Health Act if they pose a risk to themselves or others, but what the Conservatives put forward has to do with substance use.
For many decades, we have seen that involuntary care does not work. It is not effective, and it can have serious repercussions.
DJ Larkin with the Canadian Drug Policy Coalition says the research on forced treatment has shown it doesn't work at a systemic level and it has been harmful.
One of the key concerns is that someone who is put through an involuntary care process, if they use drugs from the unregulated market after that, they are at dramatically higher risk of fatal overdose.
Meanwhile, Scotty Arcondas says he was rejected 3 times when he tried to go to addiction treatment because a rapid access clinic didn't have space for him.
So going forward with a forced treatment, I question whether the logistics are there for people to go to even voluntary treatment, let alone a mandatory treatment.
Vandu is really concerned that both the government and the Conservatives are now talking about involuntary treatment at a time when voluntary treatment is not accessible. We don't need a world where police or judges or some kind of official is empowered to lock us up.
As of July, BC Coroner Service data shows that 1,365 people have died from unregulated drugs this year in BC, the leading cause of unnatural death in the province. In Vancouver, Kier Junos, City News.